saying assistant matron. So job title, that is the ANS. Place of work will be the hospital, nursing office, nursing units, and responsible for immediate superior DNS, Deputy Nursing Superintendent, NS, Nursing Superintendent or matron, responsible for nursing sister, ward sisters, and staff nurses. Now next is the job summary of ANS. So ANS is responsible for the nursing service administration either in the nursing office or in a department or a block of one or two wards or units, either inpatient or outpatient, operation theatre, ops units managed by ward supervisors or nursing sisters, or for the supervision of nursing service and patient care of हॉस्पिटल. सो हियर वी आर सीन कि जो ANS है, असिस्टेंट नर्सिंग सुपरिटेंडेंट, वो किसके लिए रिस्पॉन्सिबल है और अकाउंटेबल है? वो है कि अगर किसी एक यूनिट के लिए भी हो सकती है, किसी वार्ड के लिए भी हो सकती है, प्लस ऑपरेशन थिएटर के लिए या टोटल OBG यूनिट्स के लिए. सो इस तरह से जो भी वार्ड्स या जो मैनेज किए जा रहे हैं इधर नर्सिंग सिस्टर्स के द्वारा या जो वार्ड सुपरवाइज़र्स हैं उनके द्वारा अगर मैनेज किए जा रहे हैं तो उनका सुपरविज़न करना ये नर्सिंग ANS के रिस्पॉन्सिबिलिटीज़ में आता है. और नेक्स्ट है ही और शी हैज़ एन इनडायरेक्ट रिलेशनशिप विद द हॉस्पिटल एडमिनिस्ट्रेटर और MS with whom he or she collaborates in the absence of NS or matron. सो अगर ये NS या जो नर्सिंग सुपरिटेंडेंट है, मैट्रन है या डिप्टी नर्सिंग सुपरिटेंडेंट है, अगर ये छुट्टी पर है तो थर्ड हायर अथॉरिटी ANS है, जो कि अगर वार्ड से रिलेटेड या हॉस्पिटल से रिलेटेड कुछ इश्यूज़ हैं तो वो डायरेक्टली कांटेक्ट कर सकती है मेडिकल सुपरिटेंडेंट को और उससे रिलेटेड परामर्श प्राप्त कर सकती है. दे कैरी आउट अदर सुपरवाइजरी मैनेजेरियल एजुकेशन टीचिंग एक्टिविटीज़. और जो ANS है उसका इसके अलावा भी काम है, जैसे सुपरविज़न का काम है, चीज़ों को मैनेज करना, टाइम से पूरा करवाना, उसको भी देखना है. एजुकेशन रिलेटेड एक्टिविटीज़ अगर वहाँ पे हॉस्पिटल में कुछ हो रही हैं तो उसको भी मैनेज करना. तो ये सब चीज़ें जो हैं जॉब समरी में आती हैं असिस्टेंट नर्सिंग सुपरिटेंडेंट के. नेक्स्ट इज़ द responsibilities of ANS. So first is the ward management activities. First, organize and plan nursing care activities of the department according to hospital policies. So there will be the various policies in the hospital, maybe shift duties, duty hours will be different, in OPD or IPD patients, ICU, general ward, diagnostic rooms, operational theatre. So here she has to see this hospital policy and accordingly she has to plan the things, and also handing over and taking over from the shift duties nurses. So there will be the protocol that also she has to see there. So like this, whatever policies are there in the hospital, she has to see and she has to organize and plan nursing care activities as per the policies of the hospital. Next है आपका plans staffing pattern and advocates nursing staffs in collaboration with nursing service administration, such as how many staff nurses will be posted in various areas of the hospital with the suggestion of nursing administrator. So this she has to plan. Next, plan the necessary requirements for the department. For example, all the emergency equipments या general equipments which is needed in the hospital, in the particular ward, require that general or emergency medications, nursing procedures, articles, maintenance of standing protocols. Yes, there will be some protocol for the records and reports, inventory control, etc. So all these things she has to see or supervise. Next is the maintains discipline among nursing and other domestic staff. So she has to see this thing, their punctuality and dedication, and how they are behaving with the patient's relatives, what is their attitudes. So all these things she has to see, and if it is needed, then in between she has to intimate them, so that there will be a proper discipline will be maintained in the organization. Next is the writes confidential report after taking feedback from sister in charges of unit, such as, for example, just a performance appraisal report of employees, या reports of patients, etc. So all these things she has to keep the confidential report, and even though other reports is also there, information from the management side, so she has to keep all these things confidential. Next is the develops and maintains office records for the administration of his or her department. So as you know, there are the various records are needed in the departments, such as admission and discharge records, and then this birth and death record, or there will be the operation record, inventory records, doctor visit records, attendance record of the staff members. So likewise she has to see all these things. Next is the implements administrative policies, and next make regular rounds. So by doing this she will be familiar with the current situation of the hospital, and how many patients are admitted in the various wards, and which type of patients are there, and which area is very busy. So like this she will get a general information about whole hospital. Communicate with patients and their relatives for any problems, and if it is so, in that case she has to solve that type of problems. Ensure safety and cleanness of the department. Receives reports from night superintendent, and also she has to convey the report in brief to the nursing superintendent or the deputy nursing superintendent. Conducts and attends departmental and interdepartmental meetings and conferences from time to time. So she has to attend if there are some conferences are there, seminars are there, or some interdepartmental, means in the department, or in other with other departments, if any meetings are there, then she has to go and she has to conduct that type of meetings. Next is the accompanies NS and MS during administrative and supervisory rounds. So here she has to first of all accompany and these people, and next she has to intimate, or she has to inform the things if it is needed. In case of an emergency or something like that, she has to tell, and if there are certain issues are arising, timely she has to report. Notify any special incidents or emergency to the nursing administrator immediately. Next is the plan ward management with ward sister. For example, if I will say related to the cleaning of the ward, routine care of the patients, emergency management of the patients, or any other agenda if it is there, in that case she has to sit with the ward sister and she has to plan ward management. Next is assist nursing sister in procuring and maintain records of equipments, supplies and other materials, such as you know that there is a inventory records registers are there in the hospital in each department. So she has to see that it should be maintained properly. If anything is they are purchasing, it should be recorded properly, and if anything they are destroying, that record is also to be maintained. So likewise things to be maintained. Supervise proper utilization of staff and material in the ward. Next, in this case, suppose that if increased workload is there in any ward because of the increased number of patients. In that case, shifting the staff from one ward to another ward, and like this she is managing the things in the hospital. So she has to supervise the things, and if it is needed, then she has to shift the staff from one unit to another unit in order to in order to maintain the proper utilization of the staff and material in the department. Act as public relation officer of department and deals with the problem faced by nursing sisters, especially with class 4th employees and patients relatives, by using problem solving techniques. So in case if there is any issues are coming by the lower class employees or 4th class employees, in that case she has to solve that at their own level by using the problem solving techniques. And same way, if patients relatives are facing some of the problem, in order to that she can manage the things. Keep nursing superintendent informed about the requirement of departments. So if anything is missing in the department, या कुछ ऐसे articles are there which is not there, and if these nurses are facing problem to provide the quality based care to the patients, in that case if anything is missing or they are needed, a requirement is there, in that case she has to make a record of that thing and she has to inform this thing to the NS. Not even this, if any other issues are also there with the among the staff nurses, that also she has to inform to the nursing superintendent, and she has to find out the solution of that thing. Next comes supervisory activities. So here, establish efficient admission and discharge policy in each ward. So she has to see that daily they are maintaining the admission record or discharge record in the ward or not. And also if some certain policies are there in the hospital organization policies there, that also she has to see that it is to be maintained. Ensure quality nursing care and personal comfort. Next, encourage accurate observation, critical thinking, recording and taking over charge, maintenance of intake and output chart, recording vital signs of seriously ill patient. So she has to supervise this thing if patient is admitted in ICU or CCU like that. So if patient is very critical, in that case she has to see that complete records of the patient to be maintained, and as well as they are giving intake and this IV fluids or feeding or something like that, then she has to see that this record to be maintained that time itself in order to avoid further problems. So she has to see, and also progress of the patient to be written in the progress chart of the patient, that is also very important. So likewise each and everything she has to supervise, and whatever these nurses are doing, she has to supervise whether they are doing all these things properly or not. Ensure proper stock maintenance in each ward. As I told you, inventory record she has to see, and also if any expiry medications are there in the department, she has to see that it should be removed from the shelf. And if anything is not working properly, for example suction apparatus or oxygen cylinder, something emergency measures, so emergency measures such as this ET tube, this ET intubation tray and all these things, if anything is not working properly, of some problems are there, maybe it has broken, it is not working properly, so in that case she has to see this thing, and she has to maintain the proper stock in each ward. Ensure smooth functioning of the ward. So she has to see routine work, it should be performed on time, that staff members should come on time, and also the cleanness and everything should go smoothly. And also if patients are facing any problems, in that case then and there the problem will be to be solved to the patients. And if patient is complaining any problem, in that case doctor's round should be done as per the need of the patients. So like this is smooth functioning of the ward, and also there should be the proper collaboration with the among the staff members, those who are doing as a teamwork in the ward. So they should have the proper communication with each other, and proper handing over and taking over of the charges. All these things should go smoothly in the ward. Provide a safe and clean environment. Provide proper administration of medication, treatment and diet. So she also should supervise this thing कि अगर कोई standing orders are there, so it should be given that time itself, and routine medication also should be given on time, and if any types of diagnostic measures to be performed, that also is to be, she has to see that it should be done on time. And for diet and all, if dietitian is there or if their rounds is required, in that case she has to manage all these things in the ward. Next is the education and teaching related activities. So here she has to plan and organize classes and clinical teaching for students and staff. So if there are the new students are coming for learning purposes in the department, and if a new staff is there, in that case she has to organize the classes for the clinical teaching, so that they will come to know about the departmental policies and departmental protocol and how they have to do the work in that department. And also if there is new cases are there or some new protocols are coming in the department which she has to follow in the department, like in that case also she can organize the classes and clinical teaching also for the students of and staff she can organize. And if any new case is coming in the hospital या कुछ new medication is to be added in the protocol, so like this she has to teach the staff as well as students in the department. Next is the plan and organize in service education and training program for new staff and other staff, and also in and other wards. So this is the thing. So in service education program, as per the need of the department, she has to give the requirement, and also she can plan and organize this type of training program for the new staff also, such as during the probation, if this new staff are facing the problem, so in order to solve out the problems of the new staff, and in order to make them familiar about the protocols of the hospital, she can arrange the probationary program also for the new staff. Next is the counsel staff and students. So as it is needed, if people are facing the problem, if they are having some types of issues, in that case then and there she can counsel staff and students for the smooth functioning of the department. Now next is the general responsibilities. So participate in staff meeting. So if there is a interdepartmental meeting is there, or this administrative meetings are there, so like this, if meetings are there in the hospital, she has to participate. Keep environment stress free. Here she has to see that people should be very free, they should communicate with each other, there should as well as there should be less stress between them, and also stress free environment, or we can say productive environment will be there in the department. Attends meeting and participate in activities of personal organization. Next, carries out other duties assigned by nursing and medical administrator time to time. So she has to if people are delegating something to the ANS, either by the medical administrator or nursing administrator, so in that case अगर उसको कोई assignment मिल रहा है, in that case she has to carries out that type of other duties, and she should take the responsibility of that thing also. So this is all about the nursing superintendent ANS, and I hope this lecture will be helpful for you. So thank you so much.